Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, as well as the author of Causes of High Blood Pressure, Natural Blood Pressure Remedies. And today we're going to talk about another class of blood pressure medications that creates a pretty severe outcome that women need to know about. And certainly every drug has its risks. Unfortunately, a lot of doctors aren't aware of these risks and they're not explained to the patient. It may be in the fine print, but doctors and pharmacists don't explain this to patients so that they can make a good overall decision. And for me, it means that when we have dangerous side effects of blood pressure medications, it just makes lifestyle choices to lower blood pressure risk that much more important, because nobody dies from taking better care of themselves unless you happen to be out exercising and get run over by a bus. Short of that, nobody ever dies from taking better care of themselves. So, and it's inherently, obviously, the opposite. So the class of drugs called calcium channel blockers, which are pretty commonly used in treatment of high blood pressure. Think things like amlodipine, Norvasc, Cardizem. These are calcium channel blockers, and they're routinely used. I still have a lot of patients that come in with amlodipine. But for women, they increase the risk of some dangerous forms of breast cancer. And this is not new. This information was initially studied, gosh, probably over a decade ago, and then researchers revisited, sometimes in medication, in the drug industry, we don't want to ask the question too deeply because it might give us answers we don't want. So researchers looked at a group of almost 2,800 women, and these are women who had invasive breast cancer. Almost 900, so 880 had invasive ductal carcinoma, and another little over 1,000, so 1,027 had invasive lobular carcinoma. Anytime you put invasive with breast cancer, it's not a good combination of words, and outcomes are treatment is much harsher and outcomes are not as good. But they found that in women who were taking calcium channel blockers for 10 years or more, that it greatly increased the risk of being diagnosed with one of these types of cancers. For the ductal carcinoma, the invasive, it was a 240% increased risk, so almost 2.5 times. And for the lobular, it was 260%, so over 2.5 times increased risk. But here's the challenge, is that most cases of blood pressure come from being pre-diabetic. That whole lifestyle that increases your risk of diabetes is very bad for the blood vessels. And that alone increases breast cancer risk. So if we have somebody who's already at increased risk of breast cancer and we give them a medication that's going to, again, increase the risk of breast cancer, it is a double whammy on that particular patient. And again, just reiterates, I don't know how strongly I can say this, that we need to, if somebody has high blood pressure, we need to make the right lifestyle choices to lower that blood pressure. And if your doctor hasn't given you the information, you need to find the information because it's out there. Certainly I've given enough on my particular channels to answer those questions. I've got my ebook, I've got a boot camp course. There are answers for high blood pressure that don't involve medications that are going to cause long-term side effects. So as always, I will post a link to this particular study in the comments section. Make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.